Hello.
Hi.
Welcome, Amy. Welcome anybody out in Facebook world or watching this in the future. We're live right now on Facebook, and I'm here with Amy Parrish from the Health Department, Northwest Michigan. And my name is Jean Favor. I am a family liaison with the Great Start Collaborative and Family Coalition of Charlevoix, Emmett, and Northern Antrim counties. And I've been running these events once a month to share some information with our community about services available to families with young children. So super excited. We've had the health department on here in multiple facets, talking about all the programs that happen over there, and I think it's such a great service. I think some people I don't know, you think health department and you're like, I don't know, sewers and drains and maybe just vaccines. There's so many good programs that come out of our health department, and we're really grateful for that and happy to have Amy here today. So specifically today, Amy has a couple hats over there, but she's going to be talking to us about children's special health care services, which is something that I don't know a whole lot about. So I'm really excited to learn today, and welcome Amy here today. Amy, if you want to introduce yourself maybe and tell us
Sure.
a little bit about what you do over there.
Okay, thanks for having me. I'm Amy Parrish. I am the family health supervisor for our Charlevoix County. So I basically supervise the nurses in Charlevoix. But our health department is a four-county health department, so we cover Charlevoix, Emmett, Antrim, and Otsego counties. And then I coordinate several programs. So one of them is the Children's Special Health Care Services program. I'm also the WIC coordinator for our health department. And then I also with WIC is included our breastfeeding program and our bloodlet program as well.
What's the last thing you said?
Bloodlets,
Okay.
so like elevated blood lead levels. So
Gotcha.
yeah,
There's a whole
so-
program about that for families.
Yeah.
Okay. Well, I need to know about that. Awesome. Thanks, Amy. Yeah, we've had a few different guests on talking about WIC and breastfeeding support. So we're going to knock them all out here and go on to Children's Special Health Care Services. So tell us what that even means. Who is it for? What is a special health care service?
So it's a program through the Michigan Department of Health and Human Services. And so it's a state program, but it doesn't mean that it has to be for anybody who is on state programs. So Children's Special Health Care Services is like a health insurance for children with special health care needs. And it's from age 0 up to age 26. And that actually just recently increased in January from age 21 to 26. So that's a really great thing, a great benefit for the families who are on the program or going to get enrolled in the program. So it basically is not based on your income. So you can have any income and still qualify for the program. It's based on the child's medical condition, the severity of the condition, the chronicity of the condition, and whether or not they're seeing a specialist for. So they usually have to be receiving some sort of treatment, but it covers about 2,700 different medical conditions. And so there's a lot out there. So anywhere from, like, you get retinopathy of prematurity. So if you have a baby who's born really early and they have problems with their eyesight, it covers that. Chronic otitis media, so those kiddos who, have frequent ear infections and need to get tubes in their ears, it covers that. All the way up to like epilepsy, childhood diabetes, childhood cancers. It covers lots of those. So there are a couple of different diagnoses that you can be on for life past age 26.
Okay.
So those are cystic fibrosis, some different bleeding disorders like hemophilia, and then sickle cell disease as well. So basically, they just need to be seeing a specialist. It can't be their primary care provider. They have to see a specialist annually. And then they just, can get on the program, and then it's based, there could potentially be a payment agreement based on their income.
Okay.
So, but if they have Medicaid, it is a free program.
Okay. All right. Yeah, I have all the questions, right?
Yeah.
Thinking about that. So first of all, it's not income based, but it might, depending on your income, maybe you pay something. So
Yes,
okay.
correct.
So you'd sign up for it kind of like an insurance. I imagine we go through the health department's magical phone number.
Our 1-800
Yep,
phone number.
to get connected.
They can
Okay.
call that. We have a nurse and a tech in each county who work in this program. So if you call our 1-800 number, you can ask to talk to the nurse or the tech in the program in their county, and then they can answer questions, get paperwork started, get them, enrolled in the program if this is something that they're interested in.
And what is that 1-800 number?
It's 1-800-432-4121.
1-800-432-4121. And that accesses all the health department services.
It does.
So you call
Yes.
that and you say, here's what I'm looking for, and they'll direct me where I need to go. Awesome.
Yeah.
And that's an intake? Is that an intake number? You call that, and does that person kind of do a little brief intake interview to assess
they'll
what
probably,
you need? And
look you up, make sure we have your contact information. A lot of times they'll go over to see if you qualify for any other programs as well at the health department. And then they can actually transfer your phone call directly to the nurse or the tech in your county.
Awesome. So I go on there, they say, yes, Children's Special Health Care Services, you might qualify. So then do I do, so by that point I would have to have been seeing a specialist. My child would have to be. And so it's
Correct.
so it's using that, so I've already been referred for my general doctor to do that. So, and then they check the list of 2,700 possible conditions that they can support. And so how does it work after that? So if you get on Children's Special Health Care Services, so let's say I'm on Medicaid and it's free across the board. So do I just go in? Is there an insurance card? What's the ease of use?
So there is an insurance card, but it is, if you have Medicaid, it's already your My Health card. So your green My Health card is your insurance card. So it would be the same number as that when you're enrolled in Children's Special Health Care. So when a provider goes into CHAMPS and their billing, they can look and see that they have both Medicaid and Children's Special Health Care Services.
Cool.
And then others will get a card. They also get an eligibility letter that lists all their providers that are approved, because it doesn't cover anything other than that diagnosis. So it will cover, list the specialist, list the hospital, anybody that they're seeing on that eligibility notice. Yeah.
Okay. Yeah, that makes
sense.
sense.
And I did forget to mention too that it does not cover like autism or developmental, behavioral, or intellectual conditions.
Yep, that was a question I had, because I know that comes up. That probably comes up frequently.
It does.
People looking for support for those conditions. So this is less behavioral, developmental, but medical.
For medical, yes.
Healthcare services. Okay, so if I have Medicaid, then basically I have that approval for that service from that doctor or whatever's on the list. So I just go in and I just use my card like a regular insurance card, and it's covered.
So it can happen a couple different ways for Medicaid. So if you have a Medicaid health plan, sometimes they'll automatically enroll the child in Children's Special Health Care Services if they know they have a qualifying condition. So that can happen, but sometimes that doesn't happen. And so then if they think they would like to be on the Children's Special Health Care Program, then they would get a hold of our tech or our nurse, and then they do a release of information to request the medical report from the specialist. And so once we get that medical report, and this is for both Medicaid and non-Medicaid, we get that release of information, get the medical report from the specialist, and then that gets sent to Lansing, to the State Office of Children's Special Health Care Services. And then there's physicians down there that will review the medical information, see if they meet that chronicity, the severity, and the treatment. And then if they do and they qualify, then they will send them a informational letter telling them that they qualify for Children's Special Health Care Services. And with that letter, they can fill out an application. And so the application is sent to them. If they have trouble with the application, our techs are more than willing to help them fill that out. But it will give them the information about whether or not they would have a payment agreement. They could decide, a lot of parents, need to look at that if they have private insurance and not Medicaid, whether or not that payment agreement is going to offset the cost of their deductibles and their copays. So if they're having a lot of, they need hearing aids, or they're having surgery or multiple appointments, a lot of times it can be a huge help to families, to cover those medical bills.
Gotcha.
So anyway, so then they get their medical report reviewed, they get their welcome letter and application, and then they have 30 days to send that in to decide if they want the program. And so then they get enrolled in the program after that, or they decline it, either way. And then once they do that, then the local health department, so then our job is to get a hold of them, give them information about the program. The nurse will call them, they do a plan of care, which they go over their health history and goals that they would like to see for their health over the next year, answer any questions. We do a lot of community referrals for resources. There's also assistance with transportation. If you have Medicaid, you have to get transportation or hotel assistance through your Medicaid health plan. But if you have private insurance and not Medicaid, then we can assist with mileage reimbursement and hotel for, like, if you have to go down the night before because you have an 8 o'clock appointment in the morning.
Okay.
You don't want to get up at 4 or 5 in the morning and drive down there. So we will help with the hotel assistance as well.
Okay. So you say we, you mean that's not part of Children's Special Health Care Services? Technically,
That is.
Okay, so it is
That
part
is
of that
part
whole
of Children's
program.
Special.
Okay, through the,
Yeah.
okay. Awesome.
Yeah.
So it sounds like a lot of back and forths. And so as a family, all I need to know is I might get referred from my doctor who says, oh, look into this program, or I call the number, go through it, they get my information, then I get a letter whether I'm approved, and then I apply for it. Is that kind of?
Correct.
And then I get
Yep.
to work with the health department and my doctors
Yes.
for as long as that condition exists, or until 26,
Yep.
which is incredible. Okay. And so, and that letter you said has, if I have private insurance, and then based on my income, it'll
tell
say,
you.
so is it kind of looks like a copay sort of, is that
Kind
how
of,
it, like
yeah.
a payment?
It gives you like a lump sum that you maybe do that year, and then they do monthly payments. So you would get a payment, book, and you would pay your payments over the 12 months.
Gotcha.
So-
And there's a few people popping in and out, so if anybody is on live and has any questions or concerns or ideas or experiences they want to share about Children's Special Health Care Services, go for it and pop it into the chat box, and we'll take care of those. So are there doctors up in our area, Amy, that are on those lists? I know that's a question that we have a lot with this rural area. Is it easy to find the care of doctors that are approved for?
So that is a really difficult thing up in northern Michigan. We're
Right.
so rural that there are not a lot of specialists up in this area. I would say they're few and far between. A lot of our clients, I would say, go to DeVos Children's Hospital or
Okay.
U of M. Occasionally there are some that they see in Traverse City that do almost like a satellite clinic. A lot of the doctors from DeVos or U of M will come to Traverse City, so that makes it a little bit more easy for families with travel. But I feel like the majority of our specialists are usually downstate.
Yeah, that's kind of what I
Yeah.
expect, what we're dealing with here. So that mileage and the hotel stay and that reimbursement is really, really helpful.
huge help,
When
yes.
we have to travel. So, and I think the lifelong services that are provided, just kind of thinking about that. So it's the same process. Once you qualify, you continue on with that to.
Yeah, there is, it depends on your diagnosis, but you do have to redo your medical information. So you have to update your medical reports. It could be 1 year, it could be 3 years, depending on your diagnosis, and then your income. Like if you have Medicaid, you would automatically, they would see that and you wouldn't have to provide income
Right.
for that.
You've already
But,
did it, yeah.
Yeah, but they call it an IRBA form. So that form you have to fill out with your income, probably, I would say every 1 to 2 years.
Okay.
To determine if that payment agreement is going to change. And then if they're on the border income-wise, and they might qualify for Medicaid, they'll do a temporary eligibility period of 3 months, and then they'll ask the family to apply for Medicaid to see if they qualify, just to make sure that they have that insurance, because that would cover everything and not just their specialty conditions. So
Right. Yeah. Awesome. And so it sounds like you're calling them your techs. So the people that
Yes.
are really well versed in how this works in the system, and also, bringing all the pieces together for somebody who, even just talking to you today, it sounds like a lot of things for a family to navigate to try to,
It is. It's a
determine
big program.
is it worth it? Should I, pay down my deductible instead, or should I use this if I have a payment plan? So, there's kind of support for that to make the
Yes,
process.
definitely. They can call the tech or the nurse. I feel like the tech is usually the first person of contact, but they, most of them, I think, if not all of them, help with Medicaid applications. So they know a lot of that information and can really answer a lot of questions and help the families make that decision. So
That's awesome. And we have Brianne says she loves Children's Special Health Care Services.
Oh, great.
Caitlin says hello. Hi, Caitlin. So good to see you here today. So it sounds like a really worthwhile program to look into. Is there, so you'd be a family already seeing a specialist, or your specialist would refer you, but so is there any need for me, as a parent, to try to find this list of 2,700 potential,
No,
or
I
just
think
go
it's-
through my doctor, or go to, you already know if you need it or not.
Yeah, and a lot of times, like, we'll get a referral from the emergency room, like a report from there, and that's a lot of times how a diagnosis starts, is they don't know what's going on, and they, have a seizure or something going on, they go to the emergency room, and then the emergency room will refer them to a specialist. So a lot of times we'll get an emergency room report, and then have to follow up with a report from the specialist.
Okay.
So it doesn't always, the referrals come from the doctors, or
Right.
some could have been on for years, they've never heard of this program.
Right.
And so a lot of word of mouth. And so, like, this is a great opportunity because we can share information, because a lot of families don't know about this program. They have not heard of it. So,
Right, exactly. And Caitlin was asking, her kids no longer qualify for Medicaid, and she would like that local number to call to apply for children's special health care services. So
okay.
if you want to share
Yep.
that, that's the
So,
health department.
our 1-800 number is 1-800-432-4121. And so you can just ask to talk to the Children's Special Health Care representative or tech in the county that you live in.
Right, tell
And
me
they will
that.
get you, yep.
I'm
get you
gonna,
all-
I'm gonna attempt to reply to her comment, or I'm gonna throw it in here. 1-800
Yeah, 432
432
4121.
4121. 1-800-432. I know I've typed this a whole bunch of times, but I'll get it down too someday. So perfect. Yeah, call that number and hook up with the health department and Children's Special Health Care Services. So,
Yes.
and then you
Yep.
figure out what sort of payment options you have.
Yep, that sounds great.
Awesome. What else? What else we need to mention that we didn't get
I mean,
across?
there is some benefits of the program. There is a family center at the state that's run by parents of children with special health care needs. So that's a great tool. They have a 1-800 number that you can call. They do parent mentors. So, like, if you have a child with like a rare condition and you don't know anybody else, that has a child that has something similar, they can actually connect you with another family that has a child with the same diagnosis. So it's really great for that support and for information. It's a really, really great option that you can, reach out and ask them for. They also provide like camp scholarships through the Family Center. There's a lot of trainings. We try to share those online on our Facebook page, that you can do family trainings based on, like, there's different ones for, like, specifically for a diagnosis, or just in general. Like, there's been one about like a Children's Special Health Care 101, just information that they can get. So that's a great option. And I'd have to look up the family number. I should have had that available.
Well, probably if we call
okay.
the 800 number for your for the
Yes,
health department
and
up
then-
here, then
yeah.
they probably have that one.
We
down.
can get that.
Yeah, get that to you.
Yeah,
Awesome. The
definitely.
Family Center. Okay, yeah. I mean, we get those emails and we see their posts too. So, yeah, the
Great.
parent mentors with building that community so you feel supported when you're navigating. It's kind of a scary thing. Obviously, families that are signing up for Children's Special Health Care Services have, potentially a challenging road ahead of them. So
Exactly.
I think that's a wonderful, wonderful feature.
Yeah.
Thanks for bringing that one up.
Yeah, you're welcome. And it's easier now because we're so used to, since the pandemic, in social media and FaceTime, and it's easier to be able to talk to a different family member or a different family in a different city than you're in. So it just provides a lot more support than what we probably had in the past.
Yeah, especially up here, as we were saying.
Yeah.
A little bit rural, a little bit spread out.
Yeah.
So great, Family Center and peer support. What else, Amy? Is that it?
That's all I can think of right now.
Awesome. Yeah. So call that number if you think you qualify for that, and get started.
Yep, that's great.
Perfect. Thanks for everybody who was on today. Caitlin says amazing. Thank you very much for
Thank
that
you.
phone number. So hopefully you hear from her soon. And
Okay.
otherwise, yeah, we'll let you know if we have any more questions. And anybody that's watching this in the future, feel free to reach out to us, and we'll get those questions answered.
Okay.
Thank you so
Well,
much,
thank you.
Amy. Yeah, have a great day. Have a great day,
Yeah.
everybody.
Thank you.